We have to bring you something on hepatitis, after which we'll bring you AM Talk. The Ghana Health Service is seeking to add hepatitis B to the set of diseases that newborns are immunized against. The at-birth dose will bring to 4 the jabs given to babies. This was disclosed at the launch of a national policy on viral hepatitis by the Ghana Health Service to mark World Hepatitis Day. Hannah Dami was there and she came through with this.
Ghana Health Service statistics indicate 1 out of every 10 persons in Ghana has been diagnosed with hepatitis. It puts at about 2.5 million the number of people with a variant of the disease in Ghana. There is, however, very little knowledge about the disease amongst members of the public.
I have heard about it, but I have no idea what kind of disease it is. I want health officials to properly educate us on what hepatitis is.
I have heard of it before, but I don't know how it comes about. I have even vaccinated against it before, but I don't know much about it.
Health authorities for now are, however, focusing on the prevention of viral hepatitis, which is a combination of all the variants, namely hepatitis A, B, C, D, and E. National Program Director of the policy, Dr. Emmanuel explains why a national policy is needed to fight the disease.
The first one, Dr. Chair, is to prevent the transmission of viral hepatitis within high-risk groups and the general population. Secondly, to establish an effective surveillance system for viral hepatitis and its comorbidities. You know, the major problem was that we didn't have any data. Though the data is there, but it's not reliable. So an effective surveillance system will help us gather the data and provide you with more reliable data. And also to develop guidelines and protocols for the diagnosis and management of viral hepatitis disease and its comorbidities. And also to promote and coordinate nationwide research into viral hepatitis and its comorbidities to support the prevention, control, and management of the disease. The fifth objective is to promote access to safe, effective, and affordable diagnostic tests and treatment for viral hepatitis, and also to foster partnership with key stakeholders. As you know, we cannot control the disease without your support. All of you, all of us are needed to ensure that we provide the necessary control measures. Ongoing already is the included hepatitis B vaccine in vaccination, routine vaccination of children under 1. That's already ongoing. But here, we also want to introduce at-birth dose, that if a child is delivered, immediately is given the vaccine. That is what the policy would like to also.
Director of Public Health at the Ghana Health Service, Dr. Bedu Sarkodie, emphasized the disease, regardless of how it is contracted, can be treated.
The most reason why we have to place emphasis is it's preventable. We have a very effective vaccine for the type B, which can be used to prevent, and the various risk factors that when we stay away from them, then we can stay away from getting infected. When we stay away from needle stick injections, we stay away from the B and C. When we practice good personal hygiene, hand washing, we stay away and preventing and protecting against the type A and E. So what is causing a lot of harm, where there are good mechanisms to prevent and protect against, it's important that we do best for people to know what it is, what they should do to prevent against it. Those that are infected and those that are not with the infection go for the vaccine. Those that are already infected can go for treatment. So something you can prevent and also effective treatment. There's no reason why humanity should allow it to kill a lot more people.
One of the objectives of the new policy is to ensure everyone knows about the disease, especially the youth.
Viral hepatitis is the inflammation of the liver caused by special viruses that primarily attack the liver. And some of the examples, some of the types of the viral hepatitis are hepatitis A, B, C, D, and E. I learned a lot about the disease, and I'm going to share it with my friends at school.
Symptoms of hepatitis: vomiting, nausea, fatigue. I'll tell the person should go to the nearest clinic and test if it is positive or negative.
I know how we can prevent it. We should not engage in sex. If you get the disease, we should go to the nearest hospital. We should check. Yeah, we should go for a checkup and see how we can prevent it.
Roche Company, an organization collaborating with the Ghana Health Service on the implementation of the hepatitis vaccination policy, says it intends to make it as affordable as possible.
Those of us in private sector, we are willing to work with the government, with the Ministry of Health, to come up with a sustainable solution that the impact on the government will not be as significant as as it may look if you just look at it on the surface of it. Anything that will help them improve the quality of life, anything that will help them to be more responsible, anything that would make them understand the disease that potentially in the future may have an impact on them and their children, will be willing to come in to assist in our own little way.
In the meantime, the key message is: first, get tested for hepatitis, get vaccinated if you test positive, seek treatment, and practice safe sex. Hannah Odame for Joy News.